these kids are getting an experience never really had before.
Lisa, Dr. G is here for you. Can you explain your family situation and what you'd like to know?
Yeah, sure. I'm concerned about my 14-year-old daughter and with everything being virtual, she is doing only e-learning and maintaining her friendships only by social media. And it's her first year of high school, and it should be a time for making new friends and learning new social skills. But instead, I see her struggling to maintain friendships. So she used to be really outgoing, and now I see her being more private and quiet. So what can I do to make sure that she comes out of this knowing how to be social with others face to face?
Lisa, you're not alone. And probably as you've read parenting stuff for the last several years, as you let your daughter be on social media, you know that even before the pandemic, parents were worried, are our kids going to be able to interact with people face to face as they dive into their devices? And then the world crashed in a way that we could only let them interact on their devices. Totally understand your worry. Have you asked your daughter how she feels, if she feels less outgoing or if she feels negatively impacted?
We haven't talked about that. I do notice that she's, trying to maintain the friendships through the social media, and it's really hard because she can't get together with friends face to face. So we haven't really had that talk.
So one thing is, as parents, sometimes we don't ask those hard questions because we're afraid of pointing out what's hard or making it worse. But you might find out a couple of things. You might find out that it really bugs her, or as some studies have shown, you might find that she feels actually less social pressure starting high school this way than she would have if she had to be on and look right and sound right and act right all the time in her perception. Also, it's pretty normal for kids who are 14 or 15 to sometimes take that step internally or back, even the pandemic notwithstanding. So she might have gone through some of these developmental stages, even if it wasn't so highlighted. And also so in your face 24/7, because she's right there with you and you're really watching. But one question, whether you choose to ask her or not, hey, how do you feel about this? One question that I found really helpful with my teens, and actually, Rachel, in every relationship we have where a friend, like on those Zoom cocktails you mentioned, when a friend comes to us and they're talking to us about something difficult or we're worried about them, we can sometimes just be like, hey, I'm so grateful you're bringing me this. Before you go on, can you tell me, can I best help you with empathy, advice, intervention, or like some combination? Because then, especially for teens, but I think in our other relationships too.
Like, what do you want? Would you like help?
Yeah, like, how can I best help?
I love that. Because they're young adults. They're young, right? They're young adults.
You build trust in those relationships with your friends, but certainly with your kids, if when they give you an answer, and 85% of the time, research says they only want empathy. So if you can bite your tongue and sit on your hands and not tell them what to do when they said they just want empathy and you just give them empathy, I've found that often kids and adults will come back to you later because you built that trust and be like, okay, what advice do you have? Now I can hear it. But I also think it's really important to remember that all of her community, all of her peers are going through this same experience. So it's not the same as if, God forbid, she had an illness that kept her home, but everybody else was out having all those experiences and she was somehow falling behind. She's having a really authentic experience that she'll be able to take to those relationships and use to connect with people who've also had those same experiences when they all get back together.
Yeah, I know she's really nervous about going back to high school, and I'm sure all the kids are nervous going back to school at all because they haven't been face to face.
And I think that there's some real encouragement for all parents who are going through this hyper awareness and this worry, this increased vigilance about our kids' situation. And that is, the research is showing us that although a small percentage of kids, as always, are struggling with their mental health, most kids are having less of a hard time with this than we thought they would. That anxiety and depression symptoms that we thought would really skyrocket is limited to certain populations, and that these kids are getting an experience never really had before, which is they're going through this major upheaval and disruption at a time where their parent is paying attention to them and they're learning some strategies for managing those things while people are keeping an eye on them to make sure that things aren't getting out of hand, so that when they experience difficulty in their lives as adults, they will already have some strategies for managing that.